Slide, let's take a closer look at the Southeast. And again, you can tell visually what people have been saying, the epidemic is not evenly shared in this country. So let's go to the next slide and look at African Americans in the South. And it gets denser and higher burden of disease. And one more slide shows the rates, and I'm sorry this one doesn't show up quite as well, but the rates of females living with HIV, also disproportionately heavy burdens. A lot of the recent information on the disproportionate burden of HIV in the South has been very nicely highlighted by the Southern HIV AIDS Strategy Initiative report that's come out from Duke University recently. And a good bit of what I'll talk about comes from their report. But on the next slide, some of the CDC data, this is 2009 data, notably shows that the rate of new HIV infections per 100,000 population was the highest in the southern U.S., and that this region has been the greatest proportion of residents testing positive for HIV in 2009. Also, half of the newly reported HIV infections were in the South, although we only have 37% of the nation's population. But let's go further. Take the next slide, please, and let's look at Alabama. Because even in Alabama, the HIV burden of infection with this epidemic is not spread evenly. One of the speakers earlier today talked about pockets of infection of higher impact. And so I think we need to look at that. This map is county-level data from the Auburn University Montgomery Center on Demographic Research, and it's their 2010 data that's come out. And I want you to look at this set of counties across the middle of the state, because clearly they have higher levels of HIV infection. This part of the state, this blue band in the middle, like a belt across the state, is called the Black Belt of Alabama, and it was originally named for the rich black soil in this area. These counties show some of the highest rates per capita in the state. Some of them are more than 4 times higher than the national average. I want to give you a closer tour of these counties, their geography, and even their history. Because to quote William Faulkner, the past is never dead, it is not even past. So, these counties were at the heart of the cotton plantation South. Once, literally, these counties were the richest counties in the United States when cotton was king. They are now literally some of the poorest counties in the United States. They have very high rates of poverty. They're extremely rural, most of them. They have no public transportation systems. And they have very poor access to health care and extremely inadequate public education systems. All right, and let me see if this works, and if not, okay. I don't know if you can see that, so I'm walking over. We're starting our tour with Dallas County, home of Selma, Alabama. Selma, Alabama, where next week they're going to celebrate and reenact the 47th anniversary of this famous Selma to Montgomery Civil Rights March. Next county over, the very dark blue one in the middle, Lowndes County. Coming one more, we're into Montgomery County, capital of the state, capital of the Confederacy, home of Rosa Parks, home of the Montgomery bus boycott. Further east, Macon County, home of the Tuskegee Institute, home of the famous Tuskegee Airmen that the new movie just came out on. Red Tails came out last week, I think, nationally. Also home of the more infamous Tuskegee syphilis study that you probably know about, but I'd like to tell you a little more about because I think history affects what we're doing today. The Tuskegee syphilis study was a study conducted by the U.S. government and the Alabama Department of Public Health and the Macon County Department of Public Health over 40 years, 1932 to 1972. This is not ancient history. They studied black men with syphilis over 40 years, examined them, denied them treatment, prevented them getting treatment even after penicillin was available for treating syphilis, and in many cases denied letting them know they had syphilis. So we wonder now why there are government conspiracy theories about HIV AIDS in the African American community. They have a very real reason to have this kind of distrust that has carried over into its current day legacy of trying to work with people who have HIV or AIDS.